Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about Trousseaus sign. What is Trousseaus sign? It is a muscle spasm that occurs in hand and wrist, and it is due to neuromuscular irritability, and this you will see in patients with hypocalcemia, that is low calcium levels. It is also called Trousseaus sign of latent tetany. Tetany is involuntary muscle contraction you will see in patients with low calcium, and it is called sign of latent tetany because this sign may be positive before other signs and symptoms of hypocalcemia such as tetany, that is involuntary muscle contraction, hyperreflexia, that is increased body reflex, and 𝐄𝐧𝐭𝐢𝐫𝐴 sign, that is twitching of the facial muscle when facial nerve is stabbed. Now, how to assess for Trousseaus sign? For Trousseaus sign, you need a manual blood pressure cuff, and you should know patient's systolic blood pressure. So place a manual blood pressure cuff around arm and inflate it to the pressure greater than 20 mm of systolic blood pressure. If the patient's systolic blood pressure is 120, you can inflate up to 140 and hold it for 3 minutes. And if the sign is positive, you will see flexion of the hand, wrist, and metacarpophalangeal joints. These are the joints between the hand and the fingers. You will see flexion of all these, but the fingers remain extended. It remains extended at the interphalangeal joints. Interphalangeal joints are joints between the fingers. Now, if it is negative, you will not see any spasm or response during assessment. Now, what causes this positive sign? So, calcium is needed for normal muscle and nerve function. So, if a patient has low calcium, their muscle and nerve is already irritated. On top of that, you are inflating the blood pressure cuff greater than 20 mm of the systolic blood pressure. So, when you inflate, you are occluding the brachial artery. This brachial artery supplies blood to the lower arm. So low calcium plus low blood supply to the arm causes this spasm or response. Now let's see what are the causes of positive Trousseaus sign. It is seen in patient with hypocalcemia, that is low calcium level. It is also seen in patient with magnesium level, although it's more common in patients with hypocalcemia. Normal calcium level is 8.5 to 10.5 milligram per deciliter. Remember, calcium is important for the nerve and muscle function. So low calcium can cause nerve and muscle irritability. What are the reasons for hypercalcemia? A low parathyroid hormone. Parathyroid hormone are secreted by the parathyroid gland, and it helps to regulate calcium in our body. So when the parathyroid gland is removed, it causes low parathyroid hormone, and that can lead to hypocalcemia. Thyroidectomy. When thyroid gland is removed, parathyroid gland is located on the neck, posterior to the thyroid gland. So when the thyroid gland is removed, accidental damage to the parathyroid gland can lead to low parathyroid hormone and low calcium level. Now next is low calcium intake can lead to hypercalcemia. Low vitamin D. Vitamin D helps to absorb calcium in our body. So low vitamin D can lead to low calcium level. Low magnesium level. Magnesium is important for the synthesis and release of parathyroid hormone. So low magnesium level can lead to low parathyroid hormone, and that can lead to hypercalcemia. Chronic kidney disease. In chronic kidney disease, there is high phosphorus level. High phosphorus can lower the calcium levels in the body, and that can lead to hypercalcemia. Also, low renal production of vitamin D in CKD can lead to hypercalcemia. Certain disease condition, example pancreatitis, can lead to hypocalcemia. Or certain medicines, example antibiotics, aminoglycosides, these all can lead to hypocalcemia that can lead to positive Trousseaus sign. So today we learned about Trousseaus sign, and thanks for watching my video.